Have you ever stood in the dental aisle staring at dozens of mouthwashes and wondered, do I actually need this? Or maybe you've heard someone say, mouthwash is just a minty water. As a dentist, I get asked this question all the time. The short answer is yes. Mouthwash can be incredibly beneficial, but only when you choose the right one and use it correctly. The most important thing to understand is mouthwash is a supplement to brushing and flossing, not a replacement. In this video, I'm going to explain that what mouthwash actually does, when you should use it, how to use it correctly, and which type is best for cavities, bleeding gums, bad breath, dry mouth, and sensitive teeth. Let's get started. Can mouthwash replace brushing? Absolutely not. Think of brushing and flossing as physically scrubbing dirt off a floor. Mouthwash is more like disinfecting that floor afterward. A toothbrush removes the sticky plaque biofilm attached to your teeth. Floss removes plaque between the teeth where brushes can't reach. But even after brushing and flossing, millions of bacteria remain on your tongue, cheeks, roof of the mouth, and in tiny areas around the gums. That's where a therapeutic mouthwash becomes valuable. A good mouthwash reaches areas your toothbrush simply can't, reducing the number of harmful bacteria throughout the mouth. Research consistently shows that adding a therapeutic mouthwash to your daily routine can reduce plaque, lower the risk of gingivitis, and improve oral health compared to brushing alone. So, what are the real benefits of mouthwash? Here are the biggest benefits I see in my patients. Number one, it reaches areas your toothbrush misses. Brush bristles can't reach every fold of your tongue or every tiny space around the gums. Liquid mouthwash flows into these difficult areas and reduces bacteria throughout the mouth. Number two, it helps fight plaque and gingivitis. Many therapeutic mouthwashes contain ingredients like essential oils, cetylpyridinium chloride, often called CPC, that reduce bacteria responsible for early gum disease. If your gums bleed occasionally while brushing, a therapeutic rinse can be a helpful addition to your routine. Number three, it strengthens the enamel. Fluoride mouthwashes help remineralize weakened enamel and reduce the risk of cavities, especially if you're prone to tooth decay. Should you use mouthwash before or after brushing? This is one of the most debated questions in dentistry. The answer is actually simpler than most people think. The American Dental Association says you can use mouthwash either before or after brushing, depending on the product instructions and your personal preference. However, here's one important point many people don't know. If you brush with fluoride toothpaste and immediately rinse with mouthwash or even plain water, you may wash away some of that protective fluoride before it has enough time to work. That's why many dentists recommend waiting about 20 to 30 minutes after brushing before using mouthwash if you're using fluoride toothpaste to strengthen your enamel. Choosing the right mouthwash. Here's where many people make mistakes. Not all mouthwashes are created equal. There are two main categories. Cosmetic mouthwash. These mainly freshen your breath. They taste great, but they don't significantly reduce harmful bacteria or help prevent cavities or gum disease. Therapeutic mouthwash. These contain active ingredients that actually improve oral health. Depending on the formula, they may contain fluoride, CPC, chlorhexidine, zinc, chlorine dioxide, and or essential oils. Whenever possible, I recommend choosing products that carry the ADA seal of acceptance, which indicates they have been evaluated for safety and effectiveness. The best mouthwash for cavities. If your main goal is preventing cavities, fluoride is the ingredient you want. One of my favorite over-the-counter choices is ACT Anti-Cavity Fluoride Mouthwash. It contains the maximum over-the-counter concentration of sodium fluoride, is alcohol-free, and is gentle enough for everyday use. Another excellent option is Listerine Total Care Anti-Cavity. It combines with antibacterial essential oils, helping reduce plaque while strengthening enamel. For patients wearing braces or orthodontic appliances, Colgate Phosphor Fleur Ortho Defense is specifically designed to protect the difficult to clean areas around the brackets and wires. Here's one important tip. After using a fluoride mouthwash, avoid eating, drinking, or rinsing with water for at least 30 minutes.
Otherwise, you will wash away the fluoride before it has the chance to protect your teeth. Best mouthwash for bleeding gums. If your gums bleed during brushing or flossing, don't ignore it. Healthy gums generally should not bleed. The most common cause is gingivitis, early gum disease caused by plaque bacteria. For bleeding gums, look for mouthwashes containing CPC or antibacterial essential oils. Some excellent choices include TheraBreath Healthy Gums for Oral Rinse, Listerine Gum Therapy, Parodontax Active Gum Health Mouthwash. These products help reduce bacterial plaque and calm inflammation. But here's something very important. If your gums continue bleeding for more than 2 weeks despite good brushing and flossing, it's time to see your dentist. Mouthwash cannot remove hardened tartar beneath the gums. Only a dental professional cleaning can do that.
Best mouthwash for bad breath. Many people think bad breath is simply a smell problem. Most of the time, it's actually a bacteria problem. Those bacteria produce sulfur compounds that create unpleasant odors. The best mouthwashes don't simply cover the smell, they eliminate the bacteria causing it. Some excellent options include TheraBreath Fresh Breath, Colossus Oral Health Rinse, Colgate Total Mouthwash, Listerine Original Antiseptic. If you struggle with dry mouth, I would recommend avoiding alcohol-containing rinses whenever possible because they can make dryness worse. Best mouthwash for dry mouth. Saliva is one of your body's natural defenses against cavities. When your mouth stays dry, cavity risk increases dramatically. For dry mouth, choose alcohol-free products specifically designed to moisturize oral tissues. Some excellent options include Biotene Dry Mouth Oral Rinse, Act Dry Mouth Fluoride Mouthwash, Oral-B Dry Mouth Oral Rinse. These products help lubricate the mouth while protecting against tooth decay. Best mouthwash for sensitive teeth. If cold drinks, hot coffee, or sweets cause sharp pain, you may have exposed dentin. Specialized sensitivity mouthwashes help either block the tiny channels leading to the nerve or strengthen weakened enamel. Some of my favorite options include Listerine Sensitivity Zero Alcohol, Sensodyne Pro-Enamel Intensive Enamel Repair Mouthwash, Act Restoring Zero Alcohol Fluoride Mouthwash. Again, alcohol-free formulas are usually the most comfortable for people with sensitive teeth. So, does mouthwash really work? Yes, but only if you choose the right product for your specific needs. Remember these 3 take-home messages. Number 1. Mouthwash never replaces brushing and flossing. Number 2. Choose a therapeutic mouthwash with ingredients that match your oral health goals. Number 3. Mouthwash is an excellent addition to a healthy routine, but it isn't a cure for untreated dental disease. If you're experiencing persistent bleeding gums, severe sensitivity, chronic bad breath, or frequent cavities, don't rely on mouthwash alone. Schedule an examination with your dentist to identify and treat the underlying cause. I hope this video helped clear up the confusion about mouthwash. If you found it helpful, give this video a thumbs up, subscribe to the channel, and leave a comment below telling me which mouthwash you've been using. Thanks for watching. I'll see you in the next video.